right, so welcome back everybody. It is, I believe, our 8th Facebook Live event. We've been hosting them. This started hosting, oh, there we are. Okay, so now it's working. So welcome everybody. I do believe it is our 8th Facebook Live event, and I'm pretty excited to talk to you this time about vaccinations, the common vaccines that we give our dogs and cats all the time. You get a brand new puppy or brand new kitten, you gotta go get their puppy series or their kitten series and get them all caught up so they don't get sick. So that's what we're going to be talking about today. And throughout the event, as usual, we do encourage you to submit questions and everything like that, so that we can answer those as we go along. We are running a special on our vaccines this month. The clinic has a Pet Desk app, and so with the Pet Desk app, if you have it downloaded on your phone and it's free, it'll track what you do here at the clinic. And then if you get a vaccine, you'll get 500 Pet Desk points for every vaccine that you get. So for example, if you came in and your dog got 3 vaccines, you would get 1,500 points. And those points equal a certain amount of money back, and you can use that money for anything, other vaccines, flea tick products, anything else that you would need for your pet. So we are running that through August, so you have a little bit more time to get in on that if you'd like. It does end August 31st. And so we're going to kind of go from there. What we're going to do now is just kind of get started as everybody kind of logs on here. Again, we're going to talk about vaccines, and I'm going to kind of run through a little bit of, hey, you know, what are we vaccinating for? So I was going to start with dogs today. The big thing that everybody always thinks about with dogs is parvovirus. Oh, I need my puppy to get its parvovirus shot. So what is parvovirus? Okay, so parvovirus it's a virus. It's a type of, actually, a coronavirus, and most coronaviruses in our dogs and cats are GI viruses, and what it does is it attacks the villi and the crypts within the GI tract. So the villi and the crypts, so the crypts are these little indentations of the mucosa, the folds, and the villi are the little finger-like projections that you absorb all the nutrients from what you eat with. And it attacks those, okay? So it will wipe those out, and if you look at it under a microscope, you will actually lose all of your crypts and all of your little villi. And so you're essentially sloughing, or you are losing your intestinal lining when you get infected with parvovirus. So it most commonly shows up with bloody diarrhea, and then it can also show up with vomiting profusely as well, because when the GI tract gets very inflamed, which it does when it loses its lining, you get very nauseous, and so you vomit while you have diarrhea, so you aren't able to keep anything down. The biggest danger with parvovirus is dehydration. So if you are vomiting up everything and you have horrible diarrhea and you can't keep anything down to absorb any fluids, you're going to get dehydrated really fast. And the most commonly affected dogs are our puppies, and they don't have a whole lot of reserves. So they're going to get dehydrated really fast, they're going to get really sick, they're going to go downhill very quickly with parvovirus. The second concern we have with parvovirus is once that lining is gone out of the GI tract, you also lose a lot of your safety, okay? So bacteria naturally fill up your GI tract, and it's blocked with this barrier with the lining and different bloods and lifts and everything. Keep the bacteria where it's supposed to be. If you lose that and it's very inflamed, the bacteria that normally lives there can jump into the bloodstream, and that can become what's called a blood infection or septicemia. Okay, you can get septic if the bacteria jump into your bloodstream. You get a very high fever, you get very sick, and can also be very quickly fatal. So if you get a new puppy, okay, you definitely want to get them vaccinated for that. Where does it come from? It comes from the environment. So pretty much all Canidae, or anything in the dog family can get infected with parvovirus, and it can get spread from any of them to your domestic little puppy. They oftentimes pick it up from the environment, going around sniffing and licking everything outside, It can get in your soil, it can live there for years. If you've had parvovirus on your property at any point in time, you always just need to assume that it's still there. So very important to keep the vaccinations up with that. And even if you move into a property or you've had a property, you don't know anything of the history of it, you could have a wild coyote or a wild raccoon or something walk through your yard and bring it in. Okay, so that's you're never totally safe from it unless you have a completely indoor dog. And even then, you do run the risk of bringing it in on your shoes. Okay, so very, very contagious. If older animals get it for the first time, it's often not fatal. It's often just a very horrible episode of diarrhea and vomiting, but they have more reserves, and so they usually don't get nearly as dehydrated, and a lot of them will be able to pull through it. Now, once you get it, right, so you get sick with it, do you really need the vaccine? We definitely recommend yes. However, we don't know if a natural immunity, if you are a survivor, how long it will last or how effective it will be from getting it again. So even if you have an older dog that you just adopted from somewhere and it got parvovirus, once it's better, you still want to vaccinate against that one. So that's the big one that everybody usually thinks about. So I figured we'd start there. So that's parvovirus. The other one that gets talked about a lot with dogs is distemper. Okay, so we actually, most people hear distemper parvo. Okay, they are actually two different things for vaccinating for. The distemper virus, it's an RNA virus, and it is primarily shows up as a respiratory virus, but it can go systemic, which means that it can go and jump into your cerebral spinal fluids and cause a horrible encephalitis. It can get into the other organ tissues and the lymphoid tissues from the abdomen and everything, so you can get some GI signs with it sometimes. Most pets will present with it with a horrible respiratory infection. Is it fatal? Yes, it can be fatal. It's more fatal in puppies, again, than it is in adult dogs. Puppies are more likely to get the infectious encephalitis, or, encephalitis is an inflammation of the linings and everything in the brain, okay? So it's basically brain swelling is what encephalitis is. So it can be very fatal, okay? They can go downhill very quickly. Again, if they do survive, a lot of times they'll have some residual effects from having had the virus if they have it as a puppy. So one of the most notable things is a lot of times, not all the times, but a lot of times they'll lose a lot of the enamel on their teeth if they've had distemper as a puppy. So they'll have very yellow teeth because they'll lose that enamel white part that keeps the tooth protected. So that's one thing you can do. They tend to have brittle bones. A lot of them will end up having, especially if they have the teeth missing enamel, a lot of the survivor puppies will end up having broken tails because the tail is out there and the bones are pretty weak, and so it will have broken and healed and crooked tails. So that's something else that you can see a lot with distemper survivors. Other viruses within that big distemper parvo vaccine, we usually just call it that. It also vaccinates against adenovirus. There's two types of adenovirus. There's adenovirus 1, which is also called infectious canine hepatitis. So hepatitis refers to the liver. So it's a virus that will attack the liver and cause it to swell. And you get a lot of issues with that. So you can get very sick, a lot of GI problems. Mostly is how that one's going to show up. They usually, again, don't do very well. The other one, adenovirus type 2, that one's a primarily, again, respiratory virus. So you can see it kind of go that way. It's carried by, foxes, coyotes, wolves, otters, bears, all of those types of things. And so, again, it's just out in the environment is how most of the time they pick it up. So it is one that we want to try to keep them safe for as well. The last one that's in that main 5-way that everybody always talks about is a parainfluenza. So that is also another upper respiratory infection. It's spread dog to dog, and so that one's usually not quite as bad. It tends to just get them kind of sick, but it's nice to have it in there as well because it simply is so common. Okay, so that's kind of the main ones that you're going to get in that 5-way that everybody always talks about. So what's in the other ones, right? Like everyone should maybe be familiar with 5-way, 7-way, 9-way, all that. What are these other ways, right? So the most common thing to add in to those 5, the big 5 there, is leptospirosis. Okay, and there's multiple strains of leptospirosis. Okay, so that's where you're going to get your 7-way or your 9-way. It's how many strains of lepto is this covering for. So what is lepto? Lepto is a spirochete. So that's an infectious bacterium agent, and it will concentrate within the urine and the renal tract. Okay, so go there, concentrate in the bladder. It attacks the kidneys. They tend to not do very well, and so it's very, again, most of these viruses we're vaccinating against tend to have fairly high mortality and morbidity rate. When we're talking about lepto, the big thing is, how do they get it? It's spread through urine because it concentrates within that urinary tract, and most dogs will come into contact with it with standing water, or again just going outside, and a wild animal would pee on a tree or a blade of grass or something like that, and then they can pick it up. But if your dog is an avid swimmer, likes to drink out of mud puddles, likes rivers, things like that, they're going to get exposed to lepto. It's just a matter of time. In our particular area, we also recommend a Lyme vaccine as well. We add that into it as too. We do have a big combination that includes your distemper, your parvo, your parainfluenza, your adenovirus, your lepto strains, and your Lyme as well. And that's because we consider Lyme pretty much close to being core for this area because with the amount of Lyme disease that we're seeing. If you want to know more about Lyme, we have a previous one of these where we kind of delve a little bit more into Lyme itself. So you can go ahead and look through our history, and you can learn a little bit more about Lyme and ticks and the different preventions and everything with that. So that would be, if you're looking for more into that, we do have another one specifically about Lyme. So with that in mind, we're going to talk a little bit about our kitty cats. Okay, so the cat vaccines, the big one is the cat distemper vaccine. If you bring in a little kitten, that's one of the main ones we're going to talk about. So what's in that combination? So that one, first one it is included in there is the feline herpes virus 1. Herpes virus in cats is extremely common. Most of the time, if you're adopting a little barn kitten, it probably already has herpes, and it usually shows up with an upper respiratory. A lot of eye issues get associated with feline herpes virus. And one of the most frustrating things about herpes is that once you get it, you are a lifelong carrier, and it can flare up all the time if you ever get stressed, okay? One of the probably most frustrating signs that you can get with a chronic feline herpes virus infection is ulcers on the eye itself that just never really heal, okay? And so you keep fighting that, you keep fighting that, you keep fighting that. So if you have a kitten that looks healthy, you definitely want to vaccinate against that so you can keep it good. Other things that are included in that big combination shot is a feline calicivirus. Calicivirus is another virus that is an upper respiratory. It can have some GI signs with it, so this is one where you can actually get ulcers on the roof of the mouth or the tongue. So if you've ever in the exam room and we have a kitten that's snotty nose, we always tend to pull up the lip and look in the mouth. What are we looking for? We're looking for those ulcers, okay? And if we see those ulcers, then we know, okay, we're probably dealing with calicivirus. It likes to get secondarily infected a lot of the time, and it's going to be a little bit longer of a recovery period, okay? So again, very common among cats. Pretty much all of these viruses that we're trying to vaccinate our cats against can be carried by any felid, okay? So wild cats and everything else within that family can carry it. So if they're outside at all, they will get exposed. Panleukopenia is also included in that one. Now this is kind of a fun one, okay? Mostly because it's if the mom cat first gets infected with panleukopenia while she's pregnant, it can cross the placenta and infect the kittens. And if they don't pass, okay, so if they make it to birth and they're born, a lot of them are born with central nervous deficiencies, particularly in their cerebellum, which is a part of your brain which controls your coordination and your movement. So if you're a little kitten whose mom got infected with panleukemia and you were lucky enough to make it to birth, a lot of times you're born with what's called intention tremors. So the more you want to go somewhere, the harder time you're going to have trying to get there. It's they're actually very cute to watch. Most of them do live happy little indoor cat lives. They don't really know any different because they're born that way. So as long as you can accommodate them with easy access to food and water, eventually they will get where they're trying to go. But if you wanted to YouTube it, there are a lot of really cute videos of these adorable little fluff balls trying their darndest to walk in a straight line, but they just can't do it. So I definitely don't want to infect a mom cat with panleukopenia, as again, most of the time the kittens do end up aborting. However, if they do make it to kittenhood, they tend to be very cute because they get these little intention tremors, and if you take good care of them, they do tend to do well. But they will need some special treatments. So they're not going to be able to jump on things. They don't have very good depth perception. They're not coordinated. So you're going to have to help them out that way, but they usually do okay. The most susceptible cats to panleukopenia are about 3 to 5 weeks of age, and they're most susceptible, and it is most fatal for them to get infected with it at that time. Sorry, not 3 to 5 weeks, 3 to 5 months. My bad. Most susceptible 3 to 5 months of age with panleukopenia, and a lot of times if they do get infected at that age, it is pretty fatal. So that's one of the big ones that we want to get them covered for. It cannot get past the dogs at all. And if they do get infected as kittens after they're born, a lot of times these are kittens that get labeled as fading kitten syndrome. A lot of times it's panleukopenia, which is causing it. So the last one that's included in the main cat vaccination is chlamydiosis, which is actually a gram-negative obligate intracellular bacterium. So those are a lot of really big words, basically to mean that it's this little tiny bacteria that has to live inside your cell in order to live, and so it tends to attack. It likes to set up respiratory, usually shows up with a really nasty conjunctivitis or a swollen eye, okay? And it's not too bad. It's usually pretty self-limiting. Occasionally it can get worse, but it's really nasty. Think of it like the worst pink eye ever, okay? So that's chlamydiosis, and that is included within those vaccines. So most of them, the cat distemper, so to speak, is a lot of upper respiratory cat vaccination against different viruses. The only one that's really not upper respiratory is the panleukopenia. Oh, and I forgot to mention that it's usually a GI virus in cats. So its other name is feline parvovirus, okay? So, but feline parvo is also feline panleukopenia. It works a little bit differently in cats than dogs, which is why I don't personally refer to it as feline parvo, because it doesn't really attack the crypts the same way canine parvovirus attacks their crypts. It does cause stunting of the villi, which is how it gets that name, but I think feline panleukopenia is a better way to refer to it because you're usually going to see not as much in the GI signs and more of a problem with the nervous system signs. So other vaccines, this one isn't really considered core because we don't necessarily need it for indoor cats, but there's also the feline leukemia vaccine. Feline leukemia, I feel like, is the redheaded stepchild of cat vaccines. Not a lot of people talk about it, and it's not used as often as I think it should, because feline leukemia virus, it's got a lot, it can affect so many different things. It's actually considered an oncogene, which an oncogene is just something that can increase your risk of cancers. So if your cat gets feline leukemia, it's very likely to get a whole bunch of different cancers. It makes them predisposed to a lot of different blood disorders. It can get in the bone marrow and cause bone marrow suppression, which causes immune suppression. So you're going to get infected with a whole bunch of other things as well. You know, it can go into your central nervous system, and it can cause problems there. It can cause some GI signs. It kind of goes everywhere, okay? The reason I say it's kind of the redheaded stepchild is because a lot of people don't consider it core for most cats, but it's very contagious and very easily spread on fomites, which is basically just inanimate objects. So if you're walking around outside and you walk through a clouder of cats or a barn with a bunch of cats, okay, you have a fairly decent chance of picking it up. It's spread through all bodily fluids, and it'll live on your shirt or anything for a long time. And then you come inside and you start petting your cat. It's very easy for them to get it. And what does it do? Well, it goes in and it kind of works its way backwards, this virus does, to get into your system in so many different ways. And once it does that, the average lifespan for leukemia is around 6 years. It's one of these slow viruses that just keeps this persistent viremia going on, and it can cause all those things I listed. Okay, so if your cat is presenting with a weird thing, or it has weird growths, or we just can't really explain what's going on with this, a lot of times we're going to want to test them for it. And it is a blood test, okay, and it takes about 10 minutes to run. It's like a little witness test, and sometimes it gives the explanation, sometimes it doesn't, but it's something that can cause so many different problems. I would prefer to vaccinate everybody for it, and I feel like not a lot of people talk as much about the leukemia vaccine as they do a lot of the upper respiratory vaccine. And I think, I think it could use a little bit more attention. But the last one I'm going to talk about is a vaccine that is important for both dogs and cats, and it's important for human health as well, and that's the rabies vaccine. So we recommend a rabies vaccine for all dogs and all cats. And in fact, at least in Carroll County, the health department does require that all dogs be vaccinated against rabies. So technically this vaccine is required by law, at least for dogs. I think that using it in cats is also an extremely good idea. It is prevalent in the wildlife population as well, so it kind of keeps it going. The species most notable for rabies, being a good carrier of it, is bats. Rabies is considered endemic, which means it's a normal virus for bats. They live a normal bat life cycle when they're infected with rabies, and they're able to pass it to anything. Any warm-blooded mammal is susceptible to rabies. Now, you might see something where there's different strains of rabies. Yes, that is true. But all strains can infect all warm-blooded mammals. So it's not like, oh, well, it has the possum strain, I can't get it. Yes, you absolutely can. The difference between the strains is how quickly it will kill you, essentially, is what happens. So let's talk a little bit about, okay, well, how does rabies work, right? So rabies, you get bit, okay, is the most common way that you're going to get exposed to it. You get bit. It starts replicating in either the peripheral nerve cells or the muscle spindle cells where you got bit, depending on where you got bit. And it keeps replicating in that, and through passive diffusion, which means it's not an actively seeking this, your own body is going to slowly carry it there. It'll work its way into the central nervous system. So it goes from the veins that innervate your arm, and it's going to go up that, and eventually it's going to hit into your spinal cord and go up to your brain. So that's your central nervous system, is your spinal cord and your brain. And once it hits that system, it goes to the rest of the body very quickly. And that's when it moves extremely fast. What signs are you going to get with it? Most notably, the signs that you get with rabies, once it hits the central nervous system, is usually you're going to see weird pupils. You're going to see a lot of drooling, because it's going to affect their ability to swallow, because at that point the virus is concentrating in the salivary glands, and it doesn't want you to swallow because it wants you to pass it on really well. So you want all this saliva and everything coming. You get some interesting, some animals, depending on where the inflammation is, will tend to get a little bit dopey, and they can get dopey and then aggressive. Some of them never get aggressive. They usually get uncoordinated. Sometimes you can get some weird phobias. So one of the most common phobias that you'll see with pets, or people actually, infected with rabies, is they get terrified of water. So they get hydrophobic, and they will freak out and try to run away from water. Early signs in a bite. This might be more prevalent to keep in mind in case you get bit by something you're not sure. Early signs is the wound will be numb, and it will always be numb. So let's say you'll get bit by a raccoon, okay, and it doesn't hurt. And you're like, oh, that's weird. it should hurt. Okay? If you get bit by a wild animal, a dog or a cat, or anything like that, and it doesn't hurt, and it's completely numb, you can poke around it, and you don't feel anything, you should get checked out, okay? And they're probably gonna get you started up on a rabies vaccine. The horrible thing about rabies is that once it gets into the central nervous system, there is nothing we can do, and it is 100% fatal. If you can catch it before it gets into the central nervous system, then you can at least stop it in the peripheral nervous system. And if you aren't previously vaccinated against it, sometimes they'll amputate different parts of the body if it's far enough away. Otherwise, if you've been vaccinated or you can catch it early enough, you can get the immunoglobulins and you're going to be okay. But if it gets into the central nervous system, there is nothing we can do. So that is why, okay, we want to vaccinate all our pets at least against the rabies virus, because they're going to be out and contacting a lot more animals than you are, and they're more likely to get bit because, yeah, they'll go up and they'll check out that raccoon, or they'll check out that possum, or you know what, they were out in twilight hours when it's really good mousing time and they got bit by a bat. Okay, so those types of things happen. And the number one transfer, at least in first world countries like America, of rabies to people is our domestic cats. Because everybody is so good about vaccinating their dogs these days, but they're not vaccinating their cats. But the number one domestic species to transfer rabies to people in America is cats. Number one wild species to transfer it is bats. But you gotta keep in mind those kitty cats. The health departments usually do not require rabies vaccination for cats because cats are naturally a little bit more resistant to rabies than dogs are. It's a natural resistance to it. They're pretty strong little guys. But that's why you don't have the health department requiring it. But it's something to definitely keep in mind for your safety. I always recommend that vaccine for all dogs and cats. There is no way to test a pet for rabies with them still alive, which also makes rabies very difficult. You have to actually euthanize the animal, you have to remove its head, and you need to split open the skull and examine the brain tissue underneath a microscope to be able to say definitively whether or not it actually has rabies. So that's quite a lot to go through. And that's why vaccines are just so much easier with that. A little bit, we're going to step back now, stop talking so much about the nitty-gritty of exactly what are we trying to prevent here, and talk a little bit about the process of vaccines. So some common questions with vaccines is, how many does my pet really need? So a lot of times vaccines, at least here, we base it off of age more than number, okay? So you want to start vaccinating a dog or a kitten between 6 and 8 weeks of age, depending on how risky of an environment they are in, and then you want to continue to vaccinate every 3 to 4 weeks until they're at least 16 weeks old. Why did we come up with 16 weeks? So at about 16 weeks is when all the maternal antibodies get out of their system, and then they're able to give us a full immune response. So after that point, we know that they're good to go. We've gotten that full immune response. So what if we have a puppy or a kitten who's over 4 months old and you just got it and it was never vaccinated? So what do we do then? Does it just need one shot? Unfortunately, no. So the first time an animal or a human sees a vaccine, except for, specific vaccines, they're all going to say their own thing. The first time they see the vaccine, 70% of the population will give a full immune response. 30% will only give a partial immune response. Well, I don't know which of the pets that I vaccinate is that 30%. So I want to booster in a month, that 3 to 4 weeks, just to make sure that I've gotten that 30%, because then they will have seen it twice, and then I'll get that full immune response for that vaccine. And we know that our vaccines last for a certain period of time from research and testing and trials to see when do they lose their effectiveness, how often do we need to keep doing it, Should this be an annual injection? Can it be every 3 years? All of that comes into play, okay? So that's why even if we see a puppy or a kitten over 4 months of age, we're gonna vaccinate, and then we're gonna recommend boostering at one time if the vaccine warrants the booster. There are some vaccines that don't need a booster. So for example, there's a Bordetella vaccine or kennel cough vaccine for dogs that we give a lot as well. And we usually give this vaccine to dogs that go to groomers. A lot of boarding facilities do require it. It's an upper respiratory virus, very contagious. Most notably shows up with kind of a dry honking cough. And its fancy name is infectious tracheobronchitis, which basically just means that the trachea and the bronchi are all very inflamed. So if you even gently touch the dog on its neck, it's going to go into a coughing fit. One of the ways that you can see, I wonder if my dog has kennel cough. That's a pretty distinctive sign that he very well might have kennel cough. So it's a virus. You have to just kind of wait for the body to get rid of that. But all that inflammation, all that hacking makes them very prone to a secondary infection with a bacteria. So it's nice to have a vaccine on when you know they're going to potentially get exposed in a boarding facility to this virus, so that they don't need to go on antibiotics for a nasty respiratory infection later. So, let's see, where was I? So, lost my train of thought. Gosh, where was I? I was talking about Bordetella, kennel cough, all that good stuff. Vaccines. All right, so I guess it'll come back to me. I forget exactly where I was. Totally lost that train of thought. But so Bordetella we use in dogs that go to groomers and boarding facilities because they get exposed to a lot of pets. And we're doing puppies at this point. We talked about immunity after 4 months. Okay, so kind of the same thing with kittens. We'll just kind of roll back to that. Same thing with kittens. We want to start vaccinating between 6 and 8 weeks of age. Then we want to vaccinate every 3 to 4 weeks until they're at least 16 weeks old, that magic 4-month marker, then we get that full immune response. If we get a kitten in over 4 months of age, then we want to vaccinate it and at least booster it one time, make sure we get that full immune response. The rabies virus is a little different in the sense that the first time they ever see it, we know that the vaccine is good for only 1 year, and then if they've seen the vaccination previously, then the vaccine will be good with good titers for 3 years. So that's where you get your 3-year rabies. It is actually the same vaccine. It's just the booster to the first shot of it, and so you get a longer lasting immune response. Which reminds me where my train of thought was. So the Bordetella that we use, there's different types that we can give. And one of the types is an intranasal. So we squirt it up your dog's nose. Now, there's benefits to this because it gives you a local immunity to this upper respiratory virus, and you don't need to booster it. Its downsides are a lot of dogs really don't like it, and sometimes it's just not safe to do. So your veterinarian will decide which one is going to be the safest route to go. If you want the best immunity possible against kennel cough, so if you have experienced kennel cough in the past and you want to do absolutely everything to prevent getting it again, you would get a multimodal approach. So multimodal just means from multiple different angles to try to combat this virus. So in the ideal world, pets would be vaccinated with an intranasal to get local immunity, and then also an injectable to get more of your systemic immunity as well. So if you do that, you're going to have your least likelihood of getting that infection with that vaccination protocol. Some vaccines are more effective than others, which takes me on another little thing with vaccines. So efficacy with our vaccines, some of them are very good at preventing it. Others won't necessarily keep you from getting it so much, but it'll keep you from getting really, really sick with it. Okay, so your kennel cough vaccine is a perfect example of that. A lot of dogs who are vaccinated against kennel cough can still get kennel cough, but it's very mild. It's just kind of this annoying cough that sticks around for maybe about a week, and then the dog's fine. and they don't really ever go off their feed and they're still pretty active. They just have this like really bad cough for a little while and it goes away. Other pets who aren't vaccinated to get kennel cough get very, very sick with it, and they get the secondary bacterial infections, and they're sick for sometimes a month. And if they get it pretty bad, they can also get pneumonia with it. Okay, so that's kind of, you can kind of break down. Okay, so my dog was vaccinated against Bordetella, he still got kennel cough, but it's not so bad. And my dog was not vaccinated, and he got kennel cough, and he's still coughing. Okay, and so a lot of times those dogs need prolonged medications to help with the inflammation and wait for the cilia, which is the little hairs that help keep your trachea and everything safe. A lot of times I think in the unvaccinated dogs, it really destroys those a lot more than in the vaccinated dogs, and that's what you're waiting on to come back, and you're waiting on the body to repair that damage just because there is more damage. So it takes longer. The recovery period on it is a bit longer. The rabies vaccine is extremely effective. It works great. If you check rabies titers on a dog, they're fine, okay? So if your dog is up to date on its rabies vaccine and it gets bit by a rabid raccoon, you're going to want to watch it. But I'm not worried about that pet actually getting rabies, because our rabies vaccine works amazing. A lot of our effectiveness of our vaccines have to do with the type of virus that they're being used against. Some viruses mutate really quickly. Others mutate very slowly. If it's a virus that mutates slowly, our vaccines are going to do an amazing job. If it's a virus that mutates quickly, not so much, okay? It'll find ways around it, just simply through trial and error, because it's replicating so much. It can find ways around the vaccine a little bit. Will the vaccine be at least partially effective? Yes, because it will still have some of what we developed the vaccine against. But it will have other things, and it will be able to sneak around it a little bit. Not all the way, but a little bit. It'll be able to sneak around it. Do some of our vaccines become completely ineffective? Yeah, they do, given enough time. But a lot of times, you'll notice the efficacy of it kind of drop, and they'll come out with a newer version with the vaccine. So, an example of that would be, well, Zoetis just came out with a newer Lyme vaccine. Nobody's been overly thrilled with the efficacy of the Lyme vaccine with dogs. Now, we do know that it's definitely better than not being vaccinated, but a lot of dogs still end up coming down with Lyme even when they're vaccinated. And so they're still seeking that perfect recipe to keep those dogs fully protected against Lyme. And so Zoetis just came out with a new one. How well it works? From my personal experience, I don't think it actually works any better than the other Lyme vaccines that are out there, but it's still pretty early on to tell if it really does have a little bit better efficacy than the others at this point. I think it's probably about the same, but that's just based off of what I've seen. That's not really an unbiased opinion or a large sample size. Pretty much just the dogs I've seen walk through the door, you still get some breakthrough infections with it. Now, having said that, if your dog is vaccinated against Lyme disease and it did not have Lyme prior to its vaccination, those vaccine companies will stand behind their vaccine. And if your dog does get it, they'll pay for treatment, they'll pay for testing, and it's really kind of nice that way. So especially in an area like ours where we see a lot of it, I love it when pets are vaccinated against Lyme, because then they have an insurance policy. And if they do come in and they're having problems with it, I can just call up that vaccine company and they will foot the bill. And so the pet will get the treatment it needs, it'll be healthy and happy again, and the owners don't have to worry about the out-of-pocket expense. So that's pretty nice. So some vaccines work a whole lot better, a lot more efficacy than other vaccines. Again, a lot of it has to do with what type of virus are we attacking. Are we attacking a virus that mutates a lot? Are we attacking a virus that's really nice and stable? Kind of other things that a lot of people ask me about with vaccines is, oh, I have a Chihuahua. Does it really need the same dose that a Great Dane needs? Well, the answer to that is yes, it does. And the reason being is that the immune system in the Great Dane really is not that much different than the immune system in the Chihuahua. And it's the same. You still need to elicit the same immune response, regardless of the size of the dog. The virus is still going to attack them the same way. The virus doesn't care how big you are, okay? So the vaccine really doesn't play any effect about the amount given, but how big you are, okay? Your immune system is what we're trying to elicit a response from with that. And so whether you're, 5 pounds or 150 pounds, your immune system is what I need to excite. And your immune system is what that vaccine is treating, okay? So no, you don't give a half dose to a Chihuahua. If you're worried about having a vaccine reaction, my recommendation is to try to poke the animal as few times as possible each visit. So that does not mean vaccinate for only one virus each time. That means one needle each time. So if I have a combination vaccine that can cover for all these different viruses, I only need to poke the dog one time to cover him for a lot of different viruses. And that is no more risky than poking him one time for only one thing. The only research out there that has shown conclusively what elicits more of an anaphylactic reaction in pets is the number of times you poke them. Not the amount of antigen in the vaccine itself, but the number of needle sticks they get. And the more needle sticks they get, the more likely you are to have a big vaccine reaction. So if you're worried about a big vaccine reaction in your Chihuahua, split up your vaccines in the sense that you get the rabies one visit, okay, a week later, 10 days later, 2 weeks later, come back, get your combination vaccine. As many vaccines as you can get in one shot, all together, because that's going to give you your least likely anaphylactic reaction, okay? And so break it up that way. So do we say break up vaccines if you're worried about anaphylaxis? Yes, but not in the way that I think it gets distorted a lot of the time. What we want to break up is how many needle sticks I'm putting in this animal, not how many things I'm vaccinating them for, because that has never shown to make any difference at all with vaccine reactions. If your pet is going to get a fever after a vaccine, it's going to get it whether there's one thing in that vaccine that I gave them or 10 things in that vaccine that I gave them. The vaccine is going to elicit an immune response, okay? So even if there's only one antigen that I'm putting into that vaccine, your body's still gonna have an immune response to it. And so you'll get a fever potentially, or they'll get sleepy, or they might get a little bit sore where I gave it, all of that. On your really little guys, I think a lot of the times the soreness at the injection site is actually, again, from the needle itself. Our needles can only get so small. And if you're 5 pounds and I have this big old hunk of needle that I'm going to stick under your skin here to give you your vaccine, it's going to hurt a little bit more. If you're 150 pounds and I'm going to grab your skin and stick a little needle under there, you're going to be like, whatever, it's fine. So I think a lot of the times the soreness that we get with our vaccines and our little dogs is more, again, from that needle stick itself, okay? So I do think that little dogs should be vaccinated just as much as big dogs. And I think that if you're worried about a reaction, split up your number of needle sticks. Not so much don't vaccinate them against certain things, but just split up the number of times they get poked each visit. All right, so I think I've hit that point enough. So moving on to other common questions that I get with that one is, does my pet really need this? I kind of went through why I think our pets really do need these vaccines in order to stay healthy. And the healthier your pet is, the healthier you're going to be. If your pet is always sickly, it just kind of brings down everybody's immune system. It's just dirtier. Can you get a lot of the viruses that they get? No. Rabies is really the only real zoonotic one that we're talking about vaccinating against. But in general, if your pet is not grooming itself, they're going to bring in a lot more stuff from the environment. And if they don't feel good, a lot of times they don't groom. And they're more susceptible to other things as well. So you kind of want to keep you healthy, keep your pets healthy, all of that good stuff. And we kind of ran through already the vaccines we recommend for this area in particular, and kind of your basic rundown with what we're doing with those. So I think we're about at time. We didn't get a whole lot of questions this time. Hopefully that meant I did an awesome job and I was talking about what y'all wanted to talk about. If you were hoping I had talked about something else and you were wishing that I could maybe go into a little more detail about something, or I was too confusing about something, please just let us know. I'm always more than happy to kind of change up how I do these, and we'll get better with time. So if you want to just kind of help us out, tell me what you want to know. Do you like the nitty-gritty stuff? Do you want me to keep it more general? If you want me to focus in on something other, like more about procedures, or hey, I got a new puppy, that kind of thing, just let me know. And feel free to interrupt my little rants anytime at all. But with that in mind, I'm going to kind of wrap it up, send out my usual thank yous to everybody, especially everybody at the clinic that allowed me to do this. Without their great help, I would never be able to carve out this time to come and talk to all you lovely people. And so thank you very much to everybody else here. News and updates, everything, nothing real big is changing. In September, we're going to talk about more about animal pain. Okay, so if you want to focus more on how to identify pain in my dog versus what I do about pain in my dog, kind of let me know and I'll try to gear it more towards that. If you want to talk more about drugs and how they work, or we want to talk more about physical therapy or alternatives, you know, just let me know, okay? We got plenty of time. I can talk all day long about pain. We see a lot of painful pets. Be sure to check out our blogs. I try to answer some of the most commonly asked questions on that. We've got other videos, like I mentioned before, if you want to go and learn a little bit more about Lyme disease. I believe I talked a lot about that in my TikTok. And speaking of TikToks, I do have a TikTok channel, so you can feel free to look at that. We try to post cute videos and stuff on that. We're always looking for inspiration. So let us know if you have any things. And it was nice talking to you all tonight. Hope you have a great night. Thank you.